Hello, welcome to Psyched for Sanity. I'm one of your co-hosts, Dr. Tara McKelvey Parker. I'm a licensed clinical psychologist. In private practice, I specialize in assessing and treating complex trauma and attachment wounds from childhood.
And I am your other co-host, Dr. Brendel Doss. I specialize in geriatric psychology, forensic psychology, trauma treatment, and assessment. And are you ready? So, a couple months ago, I saw a patient.
2 months.
2 to 3.
Patient.
Yeah. Patient in a long-term care facility, like in a nursing home.
Okay.
And this was a first assessment, which we call a diagnostic assessment.
Uh-huh.
And this gentleman is an older man. And I walk in and I do my assessment with him. And he's kind of confused. He maybe has some age-related cognitive decline. He's very sweet. He answered my questions as best he could. And, you know, it went fine. He did well. I could definitely tell that he's, you know, very confused about things like, you know, he couldn't tell me exactly what his job was, things like that. But which is a little sad, but also like he was fine. He was not in distress.
Yeah.
So then I go out and check in with the nurse, kind of give her my feedback, and then I leave for the day. So I come back next week to the same facility. And then the nurse says, "I need to talk to you." And I said, "Okay, what's going on?" She's like, "You know, Mr. So-and-so." I said, "Yes, of course. Is there a problem?" She's like, "Well, he came out, he rolled out in his wheelchair after you left and said, 'Do you know why there was a strange boy asking me questions?'" Why there was a strange boy asking me questions in my room?
That's hilarious.
I've been holding on to this story and not telling you so I could get your honest reaction on film until this very moment.
You kind of do look like a strange boy who would ask questions.
I don't mind. I mean, I'm comfortable in my identity, all my parts of myself. But I just it was amazing and it was hilarious and it was so good.
That is so funny.
So, you know, he just knows there's a strange boy that visits him once a week and asks him about his feelings and his emotions.
Has he gotten more used to the strange boy who comes into his room to ask questions?
I don't see him as often. His cognition is not as much as we'd like for talk therapy.
Oh, yeah.
But for a short time period, he just knew that he had a strange boy visit him once a week. A strange boy and with a name tag.
Hey, and now I get to have a strange boy ask me some questions. She literally just thought of this story to tell right now.
I didn't plan this at all. I'm so happy and proud of myself. You have no idea how proud I am right now.
It maps on very well to what we're doing here because we wanted to do another
Q&A
because we thought it would be it's fun for us to do these.
Yes, it is.
Even though it makes
her very uncomfortable.
More nervous.
She dislikes it.
Because I like to prepare for things.
She's a planner.
I'm a planner.
I'm a planner too, but I think
different
planner.
Different kind of planner. Yeah, we have different approaches. But
yes,
we thought it would be good to do Q&A, and so she is, comes up with this story. I'm like, this is very appropriate because now I get to be asked questions by the strange boy. So
questions you haven't heard of before necessarily.
No, I don't know I have no idea what you're going to ask me.
Right. That's part of the fun of it. The part that terrifies her.
That's the part that terrifies me.
Because she wants to be prepared for everybody listening and watching, which is great. But you have great responses. And part of why I wanted to do this podcast with you and why I love doing it with you is because we have such organic, interesting, thoughtful conversations.
Yes.
So that's why I love it.
We think so. I don't know if you guys think so.
I'm fine. I'm fine.
You could go first.
I'm ready.
Mr. Strange Boy.
Mr. what?
Mr. Strange Boy.
It's Mrs. Strange Boy to you.
Well.
Okay. What is something people misunderstand about what you do and or your profession? People that are not in the world of mental health or psychology.
That's a good question.
Thank you.
The first thing that crossed my mind is that I think people tend to perceive or think that we as psychologists have all of the answers.
Yeah.
Or that we are going to be able to fix something or change something. I think people maybe give us a bit more power in that way than we have.
Yeah.
And so that can be an interesting conversation in therapy with people when they come in and the expectation is like, you're going
To fix it.
To
or
fix
me.
it. And, you know, it's going to be easy, and there's like a prescripted way to do this.
Sure.
And, yeah, I'll be all good and done with therapy. I'm like, well,
Yeah, that would be great.
you know, it would be, and I would love to be able to be like, this is exactly what you need to do,
Sure.
and this is going to make you feel better, and then you won't need any help ever again. But
Yeah,
it's,
I always
it's
tell people if
not
that was the
super
case,
realistic.
if I had like a magic wand, I'd have a lot more money and a lot more free time.
Right.
But I don't.
Well, right. I often will say the magic wand thing because I, of course, like would love to be able to make things better for everyone, you know, quickly. That would be wonderful.
Yeah.
But it's just way more complicated and more nuanced than that. And I'm a guide. I have a lot of information and knowledge and training that my patients don't necessarily have. But you, the patient, knows yourself better than me.
Absolutely. And always will.
Always will. And also are going to go at your own pace in your own way. And also there are going to be ebbs and flows in progress. And it may require, you know, several different kinds of like treatment approaches.
Yeah.
There are multiple, I like to tell people, sort of multiple layers or sort of facets of healing and treatment too. And I do long-term work, so I'm always thinking about like phases, you know, and length of time, and I always want to go deep, and it takes a little bit, it takes longer. So my approach, you know, if you want a solution or you want, you know, that would be or like a quick approach or a more like formulated kind of treatment, that I wouldn't be like the best fit.
Well, yeah, and I think a lot of people use the word advice when I in some of my sessions, and I said, you know, my job isn't really to give you advice. I might give you feedback or thoughts on things.
Well, yes, and sometimes I will give advice.
That's not necessarily, but that's not how I operate. That's not necessarily
like
the goal of treatment.
Is not going to be the treatment or the goal.
Right.
Right. I'm very aware that I give advice sometimes, and then my patients are like, I'm not going to do that.
Sure.
Or they like say they're going to, and then it's like something emotional gets in the way from them trying the thing, or like it's there's like a million reasons why.
You know, it comes up a lot in my patients is like, oh, do you give homework, or can and
I
always say, you know, I'm not a big homework girly. Like, for two to three reasons. Number one, I will probably forget the homework I gave you. Number one. Number two, as soon as we're done with this conversation and session, you will probably potentially will forget and will not do the homework that is assigned. And so...
Right. And I would probably give the homework, and then I would watch what happens, and then I would process the dynamic that unfolds.
Sure.
And it would be like a very useful relational tool.
Yeah.
And also, like, sometimes the homework is super helpful for some and can, like, structure, you know, their treatment. And I'm fine with it. But I would say most of the time people who ask for homework don't want it consistently. Or it does, like, there's, like, something else going on relationally, emotionally. Yeah, so it's just all super interesting and fascinating and complicated. And it's never just, like, here's this homework.
Well, and I will give my folks at the end of a session, say, you know, I encourage you to think about this or how this works for you over this next week, or be curious about how this shows up for you.
Yeah.
And that way, that's not, in my mind, homework, but it's like, this is like a way to go forward throughout the week and carry forward our work or our processing.
Yeah, sure.
Yeah.
So there's different, so that is the first thing that crossed my mind with that question. So, okay.
I'm ready.
I'll shoot with my first question.
Go ahead.
Okay.
I'm ready.
Okay. So what do you think it means to live psychologically well?
Oh. Can I have a definition of the term?
I think it can be whatever you want it to be.
Okay.
You can even make it, you know, a little bit more simple. What do you think it means to live a good life? There's a podcast I listen to called The Good Life Project, and the question at the end is always like, what do you think it means to live a good life? Or,
interesting.
Yeah, a healthy life or a
I always tend to shy away. I'm glad you framed it psychologically well, because I really struggle with constructs of good and bad.
Yeah.
I absolutely don't use them. I try not to use them in treatment. A lot of my patients use them, and I always try to reframe it what's helpful and hurtful.
Yeah.
So this would always, I think this question is going to be based, the answer is going to be based on how I operate in my personal and professional spheres, which is from a very relational lens. I'm a relationship girly. Relationships are very important to me.
Are they?
Yeah.
I believe you.
I know. We have a friendship. In real life, we're actually friends.
We are.
So relationships, as you know, are very important to me. And how I show up in those relationships has changed as I've grown older. and how I try to show up. And so I think to live live a psychologically well life would be to really invest and nurture in myself, intra personally, inside myself, within my own being, and to invest in interpersonal relationships in a way that's meaningful and valuable. I come at that because a lot of what I face in my day job, which is I work in nursing homes and long-term care, is a lot of people that really feel like they are no longer useful to people in their lives. And I always try to help them reframe that because there's a lot that can be limiting about people living in long-term care.
Yeah.
They don't have as much independence or autonomy, or they need help with a lot more things, and that's really frustrating. I always try to honor that. But the role they can always play in someone's life is how they show up in other people's lives, whether it's a text message to a grandkid or like a phone call to a family friend.
Right.
How they can connect with people and be present. And that's not advice giving. Sometimes it can be advice giving, but it can just be listening. It can be validating or being present, or just holding still with someone in silence. I think that's what I try to help people of that generation that I work with look at, so that way they find value and use in their personhood, even in a place and stage that can be very limiting.
That makes sense.
And so that's where, from my frame reference as a almost 42-year-old human person woman, I try to invest in those relationships and do that now.
Yeah.
If I can.
Yeah, I agree. I think relationship is really important. I also think a lot about distress tolerance. You know, when you said investing in yourself as a person,
emotion regulation.
I just kind of think about, being able to tolerate the, I want to say good and bad, but that's a little bit too simplistic, but the positive and the negative experiences that we have in life, and the ordinary experiences and the day-to-day stuff, being able to sort of hold all of it and tolerate all of it and know that it's all super normal and what makes us human, to be a little bit more content in that space, I think would be
makes sense.
Would be good.
Are you ready for your next question? You're not ready, are you?
Probably not. No.
What do you think the future will look like in terms of therapy and assessment in 20 to 30 years?
Oh, gosh. Okay, like my doomsday brain just kicked in, and I was like,
cool, let's hear it.
No,
I mean, was like, what's your honest answer though?
Well,
because we're I feel like at a precipice of a lot of things in this field.
It feels, to be honest, what it feels like to me sometimes is that there is a wealth of knowledge. We have a lot of knowledge, way more knowledge now about therapy and mental health
outcomes, research,
we
evidence,
have
tons.
Well, and just even like social media, there's a lot more. Yes, there's just a lot more awareness of mental health issues, but it feels like there's not enough support or help. So I think I mentioned this. I think if I had a magic wand and I could, in our last Q&A. So I guess my hypervigilant sort of doomsday part of my brain is well, maybe there'll be a lot more people who need help with not enough help. That's
Is that your fear?
That's my fear.
Okay.
I think is that we're not necessarily going in a positive direction with being able to support the amount of awareness that we have and the amount of
the amount of need.
The amount of need.
Oh, okay.
Right, and I think we're just more and more aware of the need because more and more people are becoming aware of their own mental health, obstacles or challenges. Right. So it feels like an explosion of awareness and information,
and not enough resources.
Okay. Interesting. So to me,
that is not the answer I thought you'd come up with.
Really, what did you think I was going to come up with? That's the first thing that crossed my mind.
I guess in my mind, I thought you'd be much more maybe it's more my answer than yours, looking at how the intersection of AI and therapy and AI and assessment.
Oh, okay, yeah, that's
sort of my answer.
Okay, that makes sense too. That maybe some of it will be more automated or something.
I do really think. I wonder. I don't think it's going to replace completely, because I think the need for a human person will always be there. I think as we've gotten more technology heavy in the world and in society, there's been a pushback in certain small areas for. I have friends that have kids, and instead of getting them a cell phone, they got them a landline. You know what I mean? That kind of almost intentionally pushing us back to the 90s. So I think there'll be pockets of people that still want
to create that
to be in a room with a person. We've seen that after COVID.
Yes. But I do. So this is a good point, and kind of, maybe ties into what I was saying, is that because I think the need is going to be so high,
yes,
sometimes things get a little bit like oversimplified or muddied, or like what's available is not as helpful. Like I have certainly talked to ChatGPT about some of my, like I've had questions, right, about my own mental health or whatever. Like, sometimes I will type in this long paragraph rant and it will help me organize my thinking, but it doesn't at all replace me going to my own therapist. Like it's not the same. I think because we're both so relational.
Yep.
Like it would be, I just don't think that is necessarily like the most helpful long term or beneficial. Like we need human engagement, and there's so, but AI like can be helpful just in a limited
I don't know how it's going to interface. I already think it's interfacing in ways that we don't fully recognize.
Totally. I think
with a lot of the AI systems that therapists are using in different platforms to like write notes and things like that.
That's true. Yeah, there's a lot more AI use for note writing and things like that. Of course, HIPAA writing, compliant and like confidential, but it kind of muddies things, makes things easier. And
some things are easier, some things would be harder.
Some things are harder. Yeah. Good. Okay. Yeah, that's a good point. What about? Do you think that too much awareness is helpful? Do you think too much awareness is helpful or harmful?
Awareness, like in just as a blanket term, or like?
Yeah, you can fill in however you want to take it.
So, hello, my name is Dr. Dawson. I'm weird. I have this thing, and it doesn't distress me or impair my function, but it's just how my brain works. I am really, not continuously, but pretty intermittently aware of a lot of really hard, big, challenging, uncomfortable things that occur in the world. And I think that can come from the places that I've worked. Even specifically within our field, I think mental health professionals deal with, people typically don't go to therapy when things are going great, right?
Yeah.
Some people do.
Yeah.
Some people do. Not everyone. But I think even in the job sites that I've chosen, federal prisons,
yes,
long-term care even,
yes,
I've worked in HIV clinics, I've worked just in a lot of really specialized, almost niche populations. And I think because I've had those experiences, I'm kind of constantly aware that someone somewhere is being hurt in some way.
Oh, no.
So this is what you asked. Awareness, is it a too much awareness a good thing or a bad thing?
Yeah.
And I don't love good and bad, but the way I try to zoom out is to keep myself in a regulated place, because you can't constantly be aware of all the pain and suffering in the world without some level of nihilism developing, which I would like to avoid.
Yeah.
As I always just try to zoom into what can I do today in this moment with who I'm with.
Yeah, and I think too much like sometimes I think like too much personal awareness, like when we're just like in our heads. I think about it as being in our heads or being like constantly thinking, or like
almost like a cognitive distortion, anxiety kind of vibe.
Yeah, or like constantly like monitoring the self, like that kind of awareness.
Oh, interesting.
Yeah, like am I doing that right, or like what is that person thinking, or like I need to be doing this more.
Yeah.
That kind of is too much. That's too intense. I do feel like there is a space where there can be too much awareness in a distressing kind of way, like you're saying too. But I also think, there are some things that I like put my blinders up and like don't want to be aware of.
Yeah, you're really good at that. I don't have that ability as much.
I mean, with the world stuff, the world happenings, like I tend to.
I know.
Yeah, to shut that stuff out a little bit.
I'm very rare. I'll be like, da 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 da. You're like, what?
Yeah.
Who? Where? And I'm like, how can you not know about this? You're like, I don't know. I don't pay attention. That's not what I look at. I'm like, okay.
I know. Well, and sometimes that feels irresponsible to me, right? Like sometimes I think
also might be effective coping at different times.
Sure. It depends on how rigidly I'm using it. And it's, my patients will bring things in all the time. And I'm like, so I inevitably get the information.
Right.
But I don't love to hear about all of the terrible things that are happening in the world.
I think it's just part of my individual experience and how I've learned to manage it. This has happened a long time ago. I was telling our friend Caroline about this, and this was at least 5 or 6 years ago, and I explained this to her, and she just kind of stared at me. She's like, whoa. She's like, that's not probably a good thing all the time. Like, how she's that level of like psychic awareness of the world at large.
I mean, sometimes I tell my patients who are overly consuming this stuff that it is probably more helpful to put up some limits and boundaries around that.
And it's not even from like inputs from like media or anything like that. It's just like historical knowledge of reality.
Yeah. What do you mean when you say that?
I'm trying to say this in a way that we're not going to get censored.
Oh.
Right now, someone somewhere is being hurt.
Oh, sure. I see what you're saying. Yeah.
Right now, some animal
Just that
somewhere.
idea of knowing
Yes,
that concept.
statistically.
Right. See.
Right now, some animal
Yes.
somewhere is being hurt.
Can you think about that?
Not all the
crosses
time.
your
No,
mind.
not. It's not. It doesn't impair function. That's why I started off saying it that way. It does not
Okay.
impair my function. It is a part of it's one of my facets and one of my experiences.
It doesn't feel like too much awareness,
No,
but it could.
it doesn't
be
limit
for
my
some.
ability to be present with
Right.
my children, to do my
Right.
job, to sleep at
Right.
night, to eat, to take care of my ADLs.
Your ADLs, your activities of daily living.
Yes, listen, that's a nursing home right there. You gotta make sure that you can rotate in the bed.
Oh,
You know what I'm saying?
Yeah.
You gotta keep
Sure.
your ADLs up.
Okay.
So I think that that's just a part of me, and I'm like I think it can be like surprising to people that don't know that, like Caroline's response. But I think it actually makes me demonstrating for people that have big emotions in session that I can tolerate really, really intense emotional experiences, be impacted, feel that, and then find a way to metabolize, process through, and move through that experience without impairing function has been super helpful to a lot of my patients.
Yeah, for sure. Yeah.
Yeah. So as we're like Q&Aing, are you becoming more open to this now? Do you like
A little bit. Yeah, I'm actually really liking okay, you need to calm down right now. That is
Jazz hands.
she's doing the most right now, and she's going to freak me out, and I'll never do it again.
Oh, well. There's the rigidity we're trying to fight, guys.
Yes, but actually, this has been a lot easier this time around doing the Q&A. I think for me, it's nice to just get into a conversation with you.
Yeah, this is exactly how when we first started, I envisioned things, because we would just go to dinner and just like, the weird term would be riff, but just like talk and process and like share about things that are interesting or cool or fascinating or confusing to us as professional, also as personal humans.
As personal,
because we're in a personal relationship.
Humans.
We're in a friendship. We're still friends. You can't take that back.
I won't take it back. I don't want to take it back.
Aww.
Even though
love
you
you.
did super, super crazy weird jazz hands a second ago. That was a little bit weird. And
I'm gonna own
concerning.
all of my pieces of myself, and I'm gonna appreciate them and love them, even if you think they're uncomfortable.
This is all experimentation. I'm just trying to like wear her down. Apparently,
It's not working.
It's not working. She's a diamond. She's resilient.
Yeah, the harder you push, the more shiny I get.
Oh well,
You didn't see that one coming, did you?
I did not see that one.
We didn't get to
coming.
talk about Harry Potter, but next time.
Next time we'll talk about Harry Potter.
If you want us to talk more about Harry Potter or not,
Yeah, or if you have questions for us,
please.
yeah, send them, because we would love to include them in another Q&A session.
Yeah.
Or
Things that are confusing to you, things you don't understand, or things you want.
Well, and too, just in general, like
Right.
topics. If you have a topic
Please.
of interest in mind for the podcast, we'd love to hear that kind of
Yeah.
feedback. So
Let us know your thoughts. This podcast is intended for informational and educational purposes only and is not a substitute for therapy, diagnosis, or any kind of professional mental health treatment. We hope that we can share with you our experience authentically and genuinely, and we hope that occasionally we'll make you laugh. Maybe you can relate to our quest and how we're psyched for sanity. The content we share is our personal opinions and insights. They are not clinical insights to anyone, and they don't represent or reflect any entity that we work and or have worked for in the past. But if listening to this podcast has made you think, we really encourage you to seek out a mental health professional in your area.